So you want to be a veterinary receptionist, or you just took the job to be a vet receptionist and you totally faked it till you made it through your interview. So you landed on this video to find out exactly what you have to do tomorrow and some things that you need to know. So in this video, I made 2 very helpful charts that you guys should definitely screenshot, print it out, put it in a notebook, and bring it to work with you. So hang tight so you can see those charts and learn a ton of terminology in this video. So what you're going to be doing as a veterinary receptionist is booking appointments, client communication, answering phone calls and answering questions, emailing paperwork, and filling out client insurance forms. And you're also going to be filling medications and selling veterinary products. And that brings us to number 1, which is the flea, tick, and heartworm preventatives that you're gonna have to be a specialist about to make things run smoothly for you as a receptionist. So I made a chart which you guys can look at right here. So take a long look at this. There are a ton of products. So you're not gonna memorize them all in one day. I highly suggest printing this out, bringing it to work, and studying the names of these products because clients are gonna wanna use what they've used in the past. And I made columns here so you can see which things have heartworm in them and what things are just flea and tick preventatives, and the route of administration. If it's topical or oral, which means they're gonna be feeding it to their pet, topical, they're gonna be pouring it on their back. Number 2 is pet vaccinations for dogs and cats. So in your interview yesterday, you told them you worked at 6 other vet hospitals, and you really haven't. Kudos to you though, everybody's gotta fake it till they make it to finally make it. So no one's mad here, just get to work tomorrow on time. So here is the chart of the vaccines that you're gonna be seeing all day long. So for dogs, your regular ones, distemper, parvo, and bordetella for kennel cough, and then the rabies vaccine, which can be a 1-year or a 3-year. And then for your cats, they're gonna get a feline distemper vaccine, which is a combo of 3 different vaccines, which I listed here, and then their rabies vaccine. You may also give them the feline leukemia vaccine too. That is if the owner wants it and if the vet wants them to get that. So one thing you're gonna see on every invoice that you guys check out as a vet receptionist is a physical exam or grouped into the office visit. So what does this office visit entail if your customer is upset about the price, which can be $100 or more? And the veterinarian is checking that animal to make sure it's healthy. So that's what you can explain to them. The veterinarian listens to their heart to make sure there's no murmur, listens to their lungs, checks their eyes for cataracts or ulcers, checks their ears to see if they're infected, checks their teeth to look for gum disease, and also palpates their entire body to check for a mass. So that fee is paying a professional to check their pet. So you're gonna need to know terminology, or you're gonna look like a deer in headlights on your first day. So let's get into it. A neuter is a castration of a male dog, taking off their balls. This is very common. A spay or ovariohysterectomy is sterilizing a female dog, taking out their uterus. That is also a common surgery, but it's a bigger surgery than a neuter. So it's gonna require more time if you're booking that surgery. Dental procedures like a cleaning is where a dog or a cat will go under anesthesia. So this is a booked appointment that needs a lot of time because the animal has to go under anesthesia. And if you see on the bill that they had extractions, this means that that dog or cat had teeth pulled. And depending on the tooth, if it's a molar, it's gonna cost more than, let's say, an incisor, which is an easier tooth to remove. A tumor removal is when a large mass is removed from a dog, which could be a lipoma, which is a fatty tumor, or a harder tumor like a mast cell tumor or something else. An internal tumor, like a splenectomy removal, is a big surgery. Then there's other things like a growth removal, which can be just a wart that is surgically removed, or a skin tag. And sometimes these require anesthesia, or they can be done with local blocks such as a lidocaine block, and they don't have to completely go under anesthesia. Along the lines of tumors and growth removals, you may also see invoiced a histopathology, either a mini one or a bigger one done that's more expensive depending on the size of the tumor, and that's when they cut it up to see if the tumor is cancerous or benign, which is non-cancerous. That doesn't spread and it just stays locally. Now stay with me, we're moving on to blood work. Blood work can be invoiced in two different ways: as a full blood work panel, which includes two different things: a chemistry, which checks the organ functions like the kidneys and the liver values, and then your CBC, which checks white blood cells and red blood cells. So if these are invoiced separately, the doctor you're working with is checking specific things. So if a dog has kidney disease, they may only run a chem panel. If the dog is anemic, they may only run a CBC to check the red blood cells to see how the dog is doing. Another routine item you'll see on an invoice is a urinalysis. So a client may come in with pee in a bag or a container, and you're like, what is this for? And they're like, I'm gonna run a urinalysis on this. Okay, now you know what that is. They're checking the pee for bacteria, crystals, or stones, or blood. Those are the normal things they'll be checking it for. Along the lines of urine, you might see invoiced a culture and sensitivity. This is when the doctor is checking the urine for specific bacteria, so they need to grow it in a lab to see what bacteria is there. And this test is usually fairly expensive. So as a vet receptionist, the reason I'm also telling you all these tests is you're gonna have to explain to customers as they're checking out why they're spending so much money on certain things. Because of course everybody is gonna be price conscious when they're at the vet or doctor or anything. So when you know these terms, it's gonna help you be a better vet receptionist to explain to the clients why they're spending this money, and that way you don't need to go talk to the manager. Another one you'll see often invoiced is glucometer, and that just means that the vet techs or the vet used a glucometer to check the pet's blood sugar, and that will let them know if a pet is diabetic or not. So that's a common test used if a pet comes in lethargic and diabetes is suspected. And then of course your fecal test. This is when someone will come in with a poop bag and they want to check their pet's poop for a parasite. Now let's go into some tests. A radiograph is an x-ray, so that's where they can x-ray the chest or the abdomen. And an ultrasound is when they're using a probe and either a specialist comes in or your vet does it themselves to ultrasound the organs or the heart, which is an echocardiogram. The abdominum is just normally an abdominal ultrasound is how we invoice it here. And that is a different scan to see the organs more clear. One last term is euthanasia. So this is something you're gonna see often too. It's very sad, but you're gonna see euthanasia invoiced, and then you may see some other drugs and like an IV catheter might be invoiced on there because they had to place that to give the drugs that put the pet to sleep. So you might see certain things itemized on the invoice with a euthanasia, so you can explain to them that those were materials needed, like a wrap or a syringe to inject things, or certain drugs like euthazol solution might be on there with the exact amount used. And then also what they're gonna do with the pet. If they're gonna cremate it, there could be group cremations or private ones where they get the ashes back. And normally those take a week or 2 weeks to come back. So you can tell the client you're gonna call them when the ashes come in and they can pick them up. So that's another big thing you'll be doing as a veterinary receptionist. All right guys, that was more than enough information for you in one video. If you're a vet receptionist yourself already and you just watch this to brush up on some terms or for entertainment, please put a comment below. And if your first day is tomorrow and this video helped you, also comment below. I would love to read it. I'm here trying to help everybody. My dad owns a vet hospital. We've been running a big practice for many years and I've had to train tons of veterinary receptionists. So I figured I'd make a video for you guys on this because I know there's so many new girls that start that need a lot of help. And one last thing before I go, when you're answering phones to angry clients, just take a deep breath, okay? People are gonna be panicked. Veterinary receptionists take on a lot of the heat of angry clients. And if you're booking them for boarding or somebody is picking up their pet from being hospitalized, Don't use the word cage. People don't like their fluffy pet, the love of their life, being caged. It's better to use the word kennel. And you can also say that they're comfortable back there with blankets, a bed, and they get walked several times a day. So use a lot of happy, upbeat terminology when you're talking to clients because they're always stressed out and worried about their pet. All right, like usual, subscribe to my channel, hit the thumbs up. It really helps my channel grow, guys. I appreciate it, and I will see you next week.